vascular occlusion with cannula. So I had a vascular occlusion scare using a cannula. Patient's skin blanched and I had to use hyaluronidase immediately. I thought cannulas were supposed to prevent this. What went wrong and how do I explain to patients that cannulas reduce but don't eliminate risk? So first, take a deep breath. At least you recognize the blanching immediately and you took action to treat it appropriately. That's exactly what proper training prepares you for. It's that skin vigilance. So now let's analyze what likely happened. Here are the 3 mechanisms by which cannulas can still cause vascular compromise, although much less. So number 1, first, perpendicular vessel approach. When a cannula meets an artery at 90 degrees, especially that artery is fixed against bone or scar tissue, the vessel cannot deflect away or move with the blunt tip cannula. So under enough pressure, even a blunt tip would penetrate. So make sure that you understand that technique. Second, cannulas behave more like needles under pressure. So if you're using a finer gauge for precision, your safety margin is more narrow. Third, extravascular compression. Even if the cannula never entered the vessel, depositing a large bolus adjacent to an artery can compress it externally, causing that external compression, essentially causing the same downstream ischemia as intravascular injection. So for patient communication, use this framing. Cannulas are like seatbelts. They dramatically reduce serious injury, but they don't necessarily make accidents impossible. I use them because safety data is compelling, and I also maintain emergency protocols for the rare event that something does go wrong. Document this incident thoroughly. Note the cannula gauge, length, entry point, product used, volume injected, timeline of symptoms, and your intervention. This protects you legally and contributes to your own pattern recognition for future cases. Skin vigilance is important. First, to recognize the injury, and to second, treat right away, going through your protocols, which we do offer from Face Med Store. We believe that injectors have reversal agents immediately accessible. You can get that through Henry Schein.